a dissection of the cat. His neck was pretty mangled already like this, so I'm kind of was trying to piece together what I think the muscles are. This right here is the masseter. The origin is the zygomatic arch and the zygomatic bone. The insertion is the angle and ramus of the mandible, and it's the prime mover of the jaw. It's the prime mover of the jaw closure, and it elevates the mandible, and it's the muscles of mastication or chewing. These are the digastrics. Origins is the lower margin of the mandible and mastoid process of the temporal bone. The insertion is inserted by connective tissue loop to hyoid bone. And here's the hyoid bone right here. And it opens mouth and depresses the mandible. What I can gather is in here, this flap right here is the mylohyoid, and it's the origin is the inner surface of the mandible. The insertion is the median raphe, and its function is to elevate the floor of the mouth by elevating and retracting the hyoid. The sternomastoids, right here. The origin is the manubrium of the sternum and the medial portion of the clavicle. The insertion is the mastoid process of the temporal bone and superior nuchal line of the occipital bone, and its function is it flexes and laterally rotates and turns head. The sternohyoid, both these right here. The origin is the manubrium and the medial end of the clavicle. The insertion is the lower margin of the hyoid bone, and it depresses the larynx and hyoid bone if mandible is fixed, may also flex skull. And the clavotrapezius, this right here. The origin is the lambdoidal crest of the skull, and the insertion is the clavicle, and it draws the shoulders upward like in shrugging. The linea alba runs midline on the anterior portion. Origin is the sternum. Insertion is the pubis symphysis. It's a tendinous raphe, which means seam, that is formed by the fusion of the rectus abdominis muscles, which include the external and internal obliques and transverse abdominis. The rectus abdominis runs parallel to the linea alba, and its origin is the pubic crest and symphysis. Its insertion is the xiphoid process and costal cartilages of ribs 5 through 7. Its function is to flex and rotate lumbar region of the vertebral column, fixes and depresses the ribs, stabilizes pelvis during walking, increases intra-abdominal pressure, and it's used in sit-ups and curls. The external obliques, its origin are by fleshy strips from the outer surface of the 8 ribs. Most fibers insert into the linea alba via broadband aponeurosis, and some insert into the pubic crest and tubercle and the iliac crest. Its function is to flex vertebral column and compress abdominal wall, aids the muscles of the back in rotating trunk and flexing laterally. The internal oblique, its origin is the lumbar fascia, iliac crest, and inguinal ligament. Its insertion is the linea alba, pubic crest, last 3 or 4 ribs, and the costal margin, and has the same function as the external oblique. The transverse abdominis runs perpendicular to the midline, and its origin is the inguinal ligament, lumbar fascia, cartilages of the last 6 ribs, and the iliac crest. Its insertion is the linea alba and pubic crest, and it compresses abdominal contents. This is the latissimus dorsi. Its attachment, or take that back, the origin is the neural spine of the last thoracic and most lumbars, and the lumbodorsal fascia. Its insertion is the tendon on the medial surface of the humerus. It's the prime mover of arm extension, powerful arm adductor, and medially rotates arm at the shoulder. This is the subscapularis. Its origin is the subscapular fossa of the scapula. Its insertion is the lesser tubercle of the humerus. Its function is the chief medial rotator of the humerus, assisted by pectoralis major, helps hold the head of the humerus in the glenoid cavity, stabilizing the shoulder joint. This is the teres major. Its origin is the posterior surface of the scapula at the inferior angle. Its insertion is the crest of the lesser tubercle on the anterior side of the humerus. Its function, it extends, medially rotates, and adducts the humerus. It's synergist of the latissimus dorsi. These are the serratus ventralis. The origins are the first 9 to 10 ribs. Its insertion is the medial surface of the scapula, and it pulls the scapula forward. And then we have the scalenes. We have anterior, medius, and posterior. Its origin is the transverse processes of the cervical vertebrae. Its insertion is the enterolaterally on the first 2 ribs, and its function is elevates the first 2 ribs, which aids in inspiration, flexes and rotates the neck. This is the clavotrapezius. Its origin is the lambdoidal crest of the skull. The insertion is the clavicle. And its function is to draw the scapula dorsod, which is toward the back, and craniod, which is anterior in animals and superiorly in humans, and it shrugs the shoulder. The acromiotrapezius. Its origin is the neural spines of the cervical and first thoracic vertebrae. Its insertion is the metacromion process and spine of the scapula and fascia of the clavotrapezius. Its function is to draw the scapula dorsod, which is towards the back, and holds the 2 scapulas together. The spinotrapezius. Its origin is the spines of the thoracic vertebrae, and its insertion is the fascia of the scapula. It draws the scapular dorsod and cauded is inferiorly and down. The levator scapulae. Its origin is the transverse process of the atlas and the occipital bone. Its insertion is the metacromion process and neighboring fascia, and it draws the scapula craniod, anterior in animals and superior in humans, so it draws it up. The supraspinatus. Its origin is the whole surface of the supraspinous fossa. Its insertion is the greater tuberosity of the humerus, and its function is it initiates abduction, assisted by the pectoralis muscles, helps hold the head of the humerus in the glenoid cavity, stabilizing the shoulder joint. The infraspinatus is the whole surface of the infraspinatus spinate. It's the whole surface of the infraspinous fossa. An insertion is the greater tuberosity of the humerus, and its function is to rotate the humeral laterally, helps hold the head of the humerus in the glenoid cavity, stabilizing the shoulder joint. The rhomboideus. Its origin is the neural spines of the vertebrae and the adjacent ligaments. Its insertion is the vertebral column of the scapula, and its function is to elevate and adduct scapula with superior fibers of the trapezius, tilts glenoid cavity downward and flexes the neck to the same side. The rhomboideus capitis, its origin is the superior nuchal line, its insertion is the scapula near the cranial angle, and its function is to pull the scapula cranially and rotate the scapula.